The rush is on. People everywhere are trying to get their COVID-19 vaccine. But a troubling skin reaction has some people second-guessing getting the Moderna vaccine in particular. But it turns out there's no cause for alarm. The reaction is known informally as COVID arm or Moderna arm, and it first made waves in January, as reported by USA Today. And while the size of the reaction frightened some people, the outlet reported it was nothing to worry about. It turns out they were right. The reaction is thought to be harmless. The New England Journal of Medicine has recently released a new letter advising doctors on how to approach COVID arm. As the lead author on the paper states, the letter was written in the hopes that more doctors will become aware of the relatively rare reaction. This will, in turn, allow doctors to reassure patients who might be concerned if they develop the signature raised red rash. Dr. Kimberly G. Blumenthal wrote in the letter, "Our immediate goal is to make physicians and other care providers aware of this possible delayed reaction, so they are not alarmed but instead well-informed and equipped to advise their patients accordingly." Dr. Blumenthal is the co-director of the Clinical Epidemiology Program at Massachusetts General Hospital. She specializes in rheumatology, allergy, and immunology, which has given her the skills necessary to advise on this unusual side effect, because COVID arm is essentially a delayed, localized allergic reaction. The reaction isn't too dissimilar to a mosquito bite, and the comparison might seem too simplistic, but it's fairly accurate. Mosquito bites turn red, swell, and itch because the bite releases chemicals into our skin that triggers an immune system response. The Moderna vaccine does essentially the same thing, although the reaction can be palm-sized. A press release from Massachusetts General Hospital earlier this month referred to it as a delayed allergic immune response. Dr. Esther Freeman, a co-author of the letter, wrote, "For most people who are experiencing this, we believe it's tied to the body's immune system going to work. The initial cases of the side effect were recorded after 12 people out of 30,000 trial participants reported the rash. Of these 12, one was misdiagnosed with a skin infection and prescribed antibiotics. Others treated the rash using corticosteroids, a class of drugs described by the Cleveland Clinic as anti-inflammatory medications used to treat skin conditions and some forms of arthritis. But most of the 12 people originally affected by Moderna arm simply used ice and over-the-counter anti-allergy medication. The thing that sets this apart from other types of allergic reactions is the time it takes to develop. Most cases started 6 to 11 days after vaccination. A week or so after that, and the rash was gone. Researchers are still looking into why the rash takes time to appear, however. They ask anyone who receives the Moderna vaccine to report allergic reactions to their research registry. A person's chances of developing COVID arm are incredibly low. 12 out of 30,000 comes out to less than 0.05%. Dr. Freeman voiced some concern the number might be slightly higher, as the original 12 were only those who developed the rash 8 or more days after vaccination. But she also cautioned that people have allergic reactions to standard vaccines as well. And there is good news for the small percentage of people who may develop the side effect. Of the 12 who have reported cases, only 6 reported another case after receiving the second shot, and none of them had a worse reaction the second time. 3 of those people had a similarly negative reaction to their first vaccine, and 3 had a slightly less negative reaction, according to the findings sent to the New England Journal of Medicine. There is a lot of concern around vaccines right now, and when people hear about a rash that might develop after they get their Moderna vaccine, it makes sense that they would be worried. But any given person's chances of developing Moderna arm are less than 1%, and there is no indication that the second round of vaccines will create a more aggressive reaction and may, in fact, cause no reaction at all. Even if it does, those who have experienced it have recovered completely without lasting effects. Dr. James McDonald of the Rhode Island Department of Health told WPRI that Moderna arm should not cause concern.
If it itches, people take an antihistamine like Claritin, or and if it hurts, you take some Tylenol. It really is nothing to be worried about.
As Dr. Blumenthal put it in her letter, whether you've experienced a rash at the injection site right away or this delayed skin reaction, neither condition should prevent you from getting the second dose of the vaccine. Check out one of our newest videos right here. Plus, even more Health Digest videos about the latest hot topics are coming soon. Subscribe to our YouTube channel and hit the bell so you don't miss a single one.